Under the idea of spreading liberty for each and every individual and their individual rights, whether intellectual or property. And we hold medical marijuana dear to us as well because we believe it's your body and if it's your property. All right, thank you.
Hi everyone, my name is Zoe Russell and I'm the Assistant Executive Director of RAMP, which is Republicans Against Marijuana Prohibition, and we basically want to work within the GOP to show that this is a limited government, basically small government issue that should be perfectly aligned with Republican principles. So tonight we're talking about medical marijuana, and it's a pretty apolitical event. We basically just want to understand the science of marijuana, how it works inside your brain and body, because a lot of us hear anecdotal stuff, but we don't know exactly how it's impacting us and if it's damaging or not damaging, safer than other medicines, or useful at all for everybody or only a few people. I just want to speak real briefly to the barriers preventing research in marijuana. What we've found, what other RAMP members have found when we talk to Republicans about this topic, is that they don't know that marijuana is so held back from scientific research. They don't know that there's extra barriers to entry to be able to research marijuana. Like, for example, did y'all know that there's no other Schedule I substance besides marijuana that has to purchase their supply for research from a government entity, which is NIDA, the National Institute for Drug Abuse. And NIDA's task is to study drug abuse. So they basically can say, even though you have an FDA-approved study, like Dr. Sue Sisley in Arizona did to study PTSD and marijuana, we can deny you access to the plant that you need to study. So basically, I'll give you an example of Dr. Sue Sisley's research. She was approved by the FDA in 2011 to study the efficacy and safety of cannabis for war veterans with PTSD. And she, like I said, was approved by the FDA in 2011, and 3 years later, NIDA still refused to answer whether or not they were going to supply marijuana for her study. The FDA basically has to give you a 30-day turnaround if they reject your study, but NIDA has no time limit. They can make you fester and fester, and in fact, that's what they did. And then it so happened that Sanjay Gupta's Weed 2 documentary came out, and in it he name-checked the PTSD study and the fact that it had been held up for so long, and lo and behold, 2 days later, NIDA and the Public Health Service sent a letter saying that they had approved it. But then they followed up with a letter saying that actually we don't have, even though in 2011 we told you we don't actually have the strain of marijuana that you requested for your study, so the wait continues. They say we can grow the strain of marijuana that you need, the high CBD strain, that's cannabidiol, that's a non-psychoactive chemical in the plant. We can grow that, but it'll probably take till maybe January 2015. So that's where that study stands right now. And actually, then, on top of everything else, the University of Arizona no longer is housing that study. They were no longer willing to be the home for that study, so they're shopping around trying to find other universities to house that study. And they've got some leads. Hopefully that gets through to a new home. And but it's just interesting that all of these government agencies seem to be pushing for this low THC, high CBD strain, and yet the one place that is supposed to legally grow marijuana has never shown any track record of being able to grow high CBD strains of marijuana. So anyway, it's just wrapped in layer after layer of bureaucracy, and it doesn't make sense to me why a law enforcement agency is scheduling drugs for the medical community in the first place. So again, what we hear all the time is we need to hear from doctors on this, from lawmakers. So we wanted to, I got to meet these doctors at the Marijuana Investment Conference in Houston, and I was so excited that they were doing research on this. So we wanted to bring them here, and I'm going to introduce, first is Dr. Elias Jackson. And Dr. Jackson was previously a professor and research faculty member at the Cardiovascular Research Center at the Yale University School of Medicine. He is a graduate of UTMB in Galveston, and he's the co-founder and president of Vyripharm Biopharmaceuticals.
Good evening, everybody. Good evening. I first want to thank the Young Americans for Liberty and RAMP for inviting me here today. I think this topic is very important. I spoke to some people today. We had a chance to do a segment with Fox News, and when I mentioned to them that there's actually a study going on in the Texas Medical Center looking at children with epilepsy, they were surprised. So in talking to Dr. Yang, I decided that I would talk a little bit about some of the findings that we have so far and some of those studies out there that have been concluded. However, when I do that, I also want to make a note that you guys understand that we still have a lot to do in this particular area, particularly in the area of development, quality control, and that is exactly what Vyripharm is focusing on. Reefer madness. So this particular movie was made in 1937, and I think it really formed the thought processes of today as far as how we feel about marijuana. I know that I myself didn't really think that marijuana in any form could be used in any positive manner other than, my friends at college that love to smoke and hang out. But if you look at this, it says weed from the devil's garden. Very frightening. Actually, this movie was entitled Tell Your Children. So we're going to tell the children today more information and the truth about this particular drug. So when we talk about medicinal marijuana, we're talking about cannabis that's utilized for medical therapy. That's for PTSD, cancer, chronic pain, epilepsy, PMS. And what's interesting is that the use of cannabis dates back thousands of years and also across cultures, in South America and Europe. And in fact, if you search the literature, you'll see that here in the United States, before 1937, medicinal cannabis was actually utilized. You could purchase it for stress, anxiety. And the interesting point here is that as far as the short-term and long-term use, short-term, we believe that there's no adverse effects. The problem here is the long-term use, because when we think about development, the developing brain usually maximizes at the age 25. And if students or youngsters are utilizing this drug, what is happening to the developing brain? That's why I said I am now an advocate, but I know that there's a lot to be done. And as long as we can get this information out and begin to discuss it and allow it to be studied by independent researchers is very important. And also in 1999, the U.S. National Academy of Sciences did a study, and they actually found that medicinal cannabis is good for anxiety and stress. So the other thing when we talk about medicinal cannabis, people think that it's this alien, dangerous thing, but actually in our bodies, we have a system called the endocannabinoid system. And it is a part of every facet of our body, from our brain, digestive tract, cellular communication. And so basically, we have a group of lipids and a group of receptors, CB1 and CB2. And this particular system is involved in homeostasis, the way we function on a daily basis, to keep our normal temperature up, to keep us at that level of normal function. So it's not an alien thing. It's a natural form, except now we have it in our body, but we want to utilize the plant to address certain disease states. So one of the findings out there in terms of migraines, it is shown that 25% of women will have issues with migraines, whereas 8% of men. But the study in California showed that over 300 cases of individuals with migraines actually was successfully treated with medicinal marijuana. That's beautiful. And if you look at the literature, you will see that these are reputable institutions that actually carried out this research. Another interesting finding was that the American Association for Cancer carried out a study where they looked at the development, the growth rate of tumors, as far as tumors in the lungs, tumors in the brain, and also the breast. And what they saw that medicinal cannabis actually retarded that growth rate. And that is huge. But more importantly, it's coming from a reputable institution. So we're not talking about something that's someone has just decided, okay, for fun, we want to utilize this drug for the medicinal cannabis just to hang out and be lazy. This actually has medicinal qualities. More so, we should now start calling it a pharmaceutical. Another study in the realm of chronic disease, Crohn's disease, diarrhea, abdominal pain. There was a study that showed that actually THC. Now, when we talk about when we talk about cannabis in general, the high aspect of cannabis comes from this particular element of the plant, and that's THC. But what they showed here was actually that THC itself has medicinal qualities in the area of abdominal pain and diarrhea. But what's interesting, if you look at the literature, in 1985, the FDA approved the use of THC to study abdominal pain and diarrhea. Now, this is very interesting. In the area of neurodegenerative diseases, it's been shown that medicinal cannabis actually has a neuroprotective property. So when we look at diseases such as Alzheimer's, the Scripps Institute showed that Alzheimer's was being able to be blocked by the use of medicinal cannabis. And we're talking about Scripps, one of the most reputable institutions of research here in the country. Now, this type of information needs to get out to our community so they know that we don't want to look at medicinal cannabis just for recreation. We also want to utilize it to help treat our ill. Now, this particular aspect of medicinal cannabis is the antispasmodic aspect. It's heart-wrenching to see the families that have to go through the suffering of their children who have epilepsy. I had the honor of meeting one of the mothers of the children that are on the study that's being carried out at Texas Children's Hospital here, where they're looking at Epidiolex to treat seizures. She said to me that her son has tried every drug out there with no effect. And once she started to utilize medicinal cannabis, she actually saw a difference. And I mean, she started to cry when she was telling me this. And it really affected me because now, as far as going forward, and when I talk to people, when I talk to my own family members who look at me and say, "Are you out of your mind? You were at Yale and now you're selling marijuana." No, I'm not selling marijuana. I'm searching for a way for us to treat our ill. And I usually don't show a lot of videos during my talks, but in this case, it's very important. I want to show you guys this particular video.
They've turned to medical marijuana to help treat his behavior. APTV's Nicole Dahl has this only on 12 investigation, but we do want to warn you. Some of the home video you're about to see, which this family took of their son, may be difficult to watch.
It's difficult to watch this video of an Oregon child hurting himself in a fit of rage. 11-year-old Alex Eccles is severely autistic. His self-destructive behavior brought on by tuberous sclerosis, a genetic disorder that affects about 50,000 people in the U.S. It causes growths in organs, in Alex's case, primarily in the brain. Those growths can lead to seizures and autism. Alex can't communicate with words, making it difficult to understand what's troubling him.
Indescribable. It was horrifying. He was able to just be acting normal and all of a sudden just run himself to a wall.
His parents have turned to a controversial treatment, medical marijuana, to manage Alex's behavior.
Well, when you've got no other options, are you honestly going to say no?
It wasn't always this way, though.
He was actually going to be Jake for the longest time, and when he was born, we saw him and said, that's not Jake, that's Alex.
The day Alex was born, Jeremy and Karen Eccles were full of hope until 6 weeks later, when their baby had his first seizure.
We didn't know he was going to be autistic at that time. I think he was 3 the first time he started hurting himself, though.
By the time Alex was 5, it was intense, self-directed rage. Alex headbutted anything he could, bruising his forehead so badly, his father says the blood would drain until Alex's entire face was black and blue. They got him a helmet, swaddled him like a newborn, tried mood-altering drugs. But Alex's daily violent behavior became the Eugene family's new normal. When he was 8, they made the heartbreaking decision to move Alex into a state-funded group home.
It was like we were throwing him away. Like we were just giving him to somebody else and saying, sorry, buddy, you're not part of the family anymore. It was pretty rough.
But was there a way to help him, to bring back this smiling boy? Alex's parents looked into Oregon's medical marijuana program, and a doctor approved Alex. Alex is now one of about 50 Oregon children with a card like this. While autism is not a qualifying medical condition like cancer or severe pain, in Alex's case, the seizures are. And after a few months of treatment, the Eccles family saw dramatic improvement.
He went from hitting himself, blood in his face, within an hour, hour and a half, he would be playing with toys, eating in hand, something that at that time was almost unheard of.
It was an extremely rare occurrence for Alex.
Alex's group home won't give him the marijuana, so about 3 times a week, his parents give him a liquid form of the drug. Oregon law does not require a doctor to monitor a child's medical marijuana use. In fact, Alex's neurologist at Dornbecker Children's Hospital didn't know about the alternative treatment until we told him. It surprised you that they were trying something?
No, I don't think so at all. I certainly am very much with them in my desire to help Alex. All of us want to help Alex.
Alex's doctor didn't speak directly about the controversy of using medical marijuana on children, but the American Academy of Pediatrics is against it. A doctor representing that group tells me that marijuana is toxic to children's developing brains, and there isn't enough known about the drug's long-term effects.
For us, the long-term side effects that are unknown for something that can't kill him are a lot better than the long-term side effects of him beating himself bloody.
The Eccles also say they're not advocating the use of medical marijuana for all autistic children, but they say walk a mile in their shoes, and the treatment might not seem so extreme.
Alex's parents say that they videotaped these episodes to prove that his injuries were self-inflicted. They've created a website about Alex's journey that includes a blog with updates, and we have a link to that on our website, APTV.
That's amazing. That is truly amazing. I mean, can you imagine every facet of their life was surrounded or focused on their son. They couldn't go to work. I mean, he was their work on a daily basis. And right here in Texas, we have families that are dealing with similar situations. So, yes, it's very important that we do more research and understand, because they're absolutely right. We don't know the long-term effects. We don't know how this affects development. We don't know the mechanism of action. Okay, how can all of the drugs that have been federally approved not work, and now a plant does? We don't understand that, but we have to carry out the research. And the only way we can do that is if the community rises up and say, hey, we want to learn more. And that's the proof right there. Now, finally, I want to show you a slide that's very interesting in reference to the death rates. So the question is, you know, marijuana, you know, the evil weed. Well, how does it stack up against other drugs as far as mortality? Well, here is a table taken from medicalmarijuana.procon.org. And first of all, I want to say that this doesn't represent the entire cases. This is just cases where the physicians or the forensic scientists actually reported their belief that the primary suspect of death was these particular drugs. So if we look right here at A, marijuana as being reported as the primary suspect of death was 0. As far as the secondary suspect, 279. Now this dates between January 1997 to June 2005, and these are only cases that were reported. Now the secondary complications, obviously we've heard about it on the news, individuals who may have taken an edible or a brownie, which actually speaks to the quality assurance and quality control. In certain cases where individuals have died, they've ingested cannabis edibles and without knowing how much was in it. Maybe they were a novice, their tolerance level wasn't high enough, but it was the weekend, it was the 4th of July, and hanging out with the buddies, and let me try a brownie. And one case where an individual, they were on top of a building, he actually jumped off. You know, secondary complications, but this is one of the goals of Vyripharm, to actually answer these questions. What is in it? How do we control it? How do we regulate it? How do we make sure that a patient is able to self-medicate? You know, and then that goes to the questions of, well, number one, weight. Right now, there's no quality assurance or quality control as far as, okay, if I weigh 300 pounds versus 100 pounds, how much of an edible should I take? Genetic predisposition. If I have a history of schizophrenia in my family, you know, if I take a certain amount of THC, will that adversely affect me? These are very, very important questions. So we want to have a realistic view at where we are. We're at the very beginning, but it's very important that we plow through. So let's look at some of the drugs used to treat vomiting. Now, these are drugs that are on the market and that have been approved by the FDA. In this particular study, 196 cases where the primary suspect of death was these anti-vomiting drugs. Spasmodics, drugs to treat muscle spasms, 118. Antipsychotics, 1,593. And then other drugs such as ADD, erectile dysfunction. Yes, the blue pill does kill. Over 8,101. So if you look at the bottom for the total, out of, when you do a comparison between medicinal marijuana or marijuana in general versus 17 FDA approved drugs, you see that 10,000 of those 10,000 reported cases of the primary suspect were these approved drugs. But how many was marijuana? 0. So there's nothing to be afraid of. You know, there's absolutely nothing to be afraid of. We have to study it. I am not an advocate of just opening the floodgates and, hey, let's go for it. No, I want intense, independent, high-level, high-powered research so we can actually understand what we're dealing with. We see that it works, but we don't know how it works. So I'm going to leave you with a quote from Dr. Sanjay Gupta. Every 19 minutes, somebody dies of a prescription drug overdose. That doesn't happen with marijuana. Thank you, guys.